The country, the coast, rural iddles. Well, for a well-resourced retiree, it probably would be. But let's look at the reality for a significant percentage of the population in remote, rural and coastal areas.
Hi, I'm Jill Beck. I'm a member of the Conference of Honorary Secretaries of Divisions, and I was asked on behalf of the conference to propose a motion bringing to attention of the wider BMA the challenges, the poor health outcomes, the deprivation and the difficulty of accessing the NHS care of people in remote, rural but also coastal areas.
So I'm a graduate. Before medical school, I worked as an optometrist, and I worked in Pembrokeshire, which I think by any reasonable definition is rural and coastal. Beautiful area. Unfortunately, access to healthcare provision is not necessarily fantastic. So from my background, I'm a medical student. Before university, I worked as an optometrist, and I saw firsthand how you could have significant geographical sort of discrepancies in care. For example, I used to work in Pembrokeshire. We quite often have to refer on weekends emergency patients to Aberystwyth. If you'd have to leave Wales, it'd take you 7 or 8 hours to access the critical care that you'd need. In optometry, what we developed was a nationwide scheme, and what we were able to achieve was in essence that patients could access healthcare local to them in a more expedient manner, and the knock-on effect from this was that the capacity in secondary care was freed up by the fact that there was fewer referrals into it. And this all came from a nationwide strategy which involved the NHS, which involved doctors, which involved allied health professionals such as optometrists.
We've got to break down the silo working. There are some tremendous local initiatives for this bit and that bit and the other bit, but I could find nothing that joins it all up together so that you can learn from best practice, so you can actually target investment that's needed in the most cost-effective way. And that's why we want the BMA on the case.